All right, so I'm Megan, and I don't know if y'all know what the Children's Advocacy Center is. It's the little yellow house right in front of Juvenile Probation as you're going down Interloop by the animal shelter. And so that's where we are. That's where we get to go to work every day. It's really awesome. We see children. And I'm a child and family therapist there and the clinical supervisor. And what we do specifically at our center is we offer forensic interviews, and then we do counseling for children who have been abused or neglected. This is Rebecca Hubbard over here. She has been a counselor for 24 years. She is amazing, quite an asset to us, and has worked specifically with trauma all of her career. Yes. And have had we've both had several kiddos who've been sex trafficked, and so that's what we're going to be talking about. Our focus is on youth, but if you have any questions about other types of sex trafficking populations, just let me know. Anything else, Miss Rebecca?
Nope.
Awesome.
Nope.
Awesome.
All right, so our objectives are to give you some statistics, because a lot of people say, hey, this doesn't happen in our area. So we're just going to talk to you a little bit about how frequently it does happen. And then we want you to be able to have some signs to look for in your job, since you're going to run into these people, these kids, and then how to interact with them when you think you have run into one of them.
Yes. All right. So we also have chocolate to bribe you guys to participate. So what images come to mind?
Please wait for me to come to you with the mic.
Images where the child, like, hand over the mouth, not speaking.
Yes.
Or bondage.
Good. Exactly. Yeah. Anybody else? Other images that come into your mind about sex trafficking?
For me, I feel like there was something going around for a while where they had teenagers going into different malls and being scouted that way.
Yeah, absolutely. Very good. Anybody else? Got one in the back.
The movie
Taken, yes. We get that every time. Absolutely. And you have one, yes, ma'am?
Multiple cell phones.
Multiple cell phones. That's clever. Yeah, absolutely. Anybody else? Any other images? So a lot of you guys were kind of describing something like this, bondage, that you might see ligature marks, things like that on the client. But this is not what we see typically here in our county. In fact, I don't know that I've ever had a kiddo who's told me they've been bound and held in this county, but it definitely happens. It absolutely happens. But we're going to kind of talk to you about what we've seen with our clients.
Okay, so that's a lot of people globally, right? And that includes kids and adults. Let's look at what we have for kids, for Texas.
Oh.
So Texas is third in the nation for sex trafficking. Can you believe that? Behind New York and California. Mm-hmm. Interstate 10 is a huge pathway for trafficking here in our state. And we'll talk specifically about Houston in just a minute.
Yeah, and I-35 as well.
Mm-hmm.
So in 2018, this is from the National Human Trafficking Hotline, which I'm sure you guys are familiar with. If you're not, I actually have some cards that I need to go grab and pass out.
Okay.
Because they have the phone number on them, and it'd be great if y'all could put that phone number into your cell phones today so that you have it ready to go. But the statistics from this hotline in 2018 were that there were 185 youth who were reported as being sex trafficked in, I believe this is in Texas.
Yeah.
And there were overall 455 human trafficking cases reported. So that can be things like labor trafficking as well. That being 383 females, 69 males. For youth, it was 185, and adults for sex trafficking was about 270. And this was in Texas. And overwhelmingly 84% are female, the victims.
Mm-hmm. And what we need to know about this statistic is that it is low. right? If the case didn't get referred to the national hotline, then they didn't know about it and it didn't go in their numbers. And so one of the really horrible things about this tragedy is we don't know exactly how many kids, but we can tell you that isn't the real number, and it's nowhere near the real number because everybody's keeping it kind of in isolation. They have theirs, the police have theirs, and nobody's putting it all together.
And Vivian, if you wouldn't mind, my purse is over here, and I have a whole stack of cards. I really want everybody to have one. Thank you so much. They're laminated cards, and it's going to have some signs to look for sex trafficked victims, so you can keep it in your wallet, in your office, whatever. And it has the phone number on the back. So vulnerable populations. Who do we think of when we see kiddos come into our center? These are typically the populations we see. We have a child who is homeless, a child who is traveling by himself, children who've been involved in natural disasters like hurricanes, things like that. I think in Louisiana, you said that there was
Katrina, right? When a lot of kids were separated from their parents, and we had a lot of kids being housed at the Coliseum there, right? The Superdome. We had a lot of kids being sex trafficked after Katrina. It's a very, very common thing that a lot of people don't know anything about.
Yes. LGBTQ population and immigrants, people who don't necessarily speak the language. This is very strong statistic right here that I think is absolutely accurate. One in 3 children who run away are lured into sex trafficking in 2 days. 1 in 3. There's 6,000 runaway minors in Houston alone. So you can imagine how many of these kiddos are actually being recruited versus what's really being reported.
So if sex trafficking victims in our area don't look like the kid who was bound, tied up, tape over his mouth, all those things, what do they look like? Well, they can live at home. They can be recruited, I think this young lady said, by friends, by other peers, which is we're not telling kids, hey, pay attention to your friends or kids who are your own age and what they're trying to get you to do. We say, hey, don't talk to strangers. And that's not where the problem is right now.
And kind of just delving into this a little bit more, juvenile probation, we know, is a very big area of entry. A lot of pimps are sending kiddos to juvie, having them commit crimes in order to recruit children from there into life. And so if you think about it, a lot of kiddos who go to juvie aren't going to want to go home. They don't like the rules there. And so their peers in juvenile probation are promising them a lot of fun and some parties and some drugs and no rules. And so that is a huge way that kiddos are getting brought into the life.
Yeah. So when we think about pimps, we always think about somebody who looks sort of like this. But pimps can also be parents. Lots of our cases have come from families pimping their own children, grandchildren, children, aunts, uncles. Pimps can also be women, which appalls a lot of people, but it is true, and they can fly on the radar much longer than men. And they can be upstanding people in our community that we would not ever think would do this to kids.
So some signs to look for, and your job is specifically, we tried to make a few suggestions for what to look for. Kiddos are pretty tricky to get to open up, but we have some tips for you guys here. Oh, but first, we're going to go over this case study. Rebecca and I, like we said, have had quite a few sex trafficked kiddos come to see us. So in order to protect their confidentiality, we kind of squished together a bunch of their stories. And so this represents several of our clients, but I'm going to go ahead and read this out to you now. Sam is a 12-year-old girl presenting at your clinic complaining of belly pain and nausea. This is the 3rd time she has been seen this year. The last 2 visits, she was treated for UTIs. She has dark circles under her eyes, her nose is red, and she often sniffles. She says she has allergies. She's well dressed in expensive name brand clothing and shoes. Her hair is nicely done. She looks much older than her stated age. She constantly texts on her latest iPhone XS Max. You notice a name tattooed at the base of her skull. She vacillates between being flirtatious and angry and defiant with you. She startles when there's a loud noise in the hallway and constantly watches the door. She is accompanied by her grandmother, who is dressed in clean clothes but not name brand clothes and shoes. Her grandmother asks Sam to put the phone away, but Sam does not do it and becomes very upset when the grandmother insists. Grandmother tells you that she cannot control Sam. Sam refuses to go to school, complaining that she's too tired. She often sneaks out at night, and when grandmother sets limits, she runs away from home. Exam and tests conclude that Sam is severely constipated and she is pregnant. When you ask about how she got pregnant, she gives you a vague story. So I'm going to go to the next slide, which has some questions, some more chances for you to get some chocolate, and then I'll come back so that you can read this. So what are we looking for? Risk factors, signs that she may be a victim, sex trafficking victim, and what questions would you ask as a medical professional? Anybody?
Before you answer a question, wait till the mic gets...
Okay. So
I would ask what the tattoo meant.
yeah.
Okay.
Yeah, 12-year-old with a tattoo, pretty strange, yeah. Oh, and chocolate. Yeah. Anybody else? What are some more signs that Sam may be sex trafficked?
That she's, I just lost my train of thought.
That's okay.
Oh, the clothes she's dressed in.
The clothes she's dressed in, the very nice clothes, very expensive clothing, expensive shoes, doesn't really add up with maybe her socioeconomic status. Absolutely. Yes, ma'am.
She's also young with a decent history of UTIs, like
Right.
repeated UTIs.
So that's not something you would see typically in a 12-year-old with that many UTIs. Absolutely. Anybody else?
She's
pregnant. Yes. 12 years old and pregnant.
Isn't it amazing how many of us didn't blink an eye at the fact that she was 12 and pregnant?
Yeah.
Yeah.
Yes, that's
and
a good
actually,
point.
sometimes medical professionals don't even ask. Like, they're 12. How did you get pregnant? What happened? Who's the father of the baby?
Right.
They don't ask.
I think you has talked to me about a client who in the past was so upset because she had been to a clinician, to a medical professional multiple times with multiple UTIs. I think it was the school nurse.
The school nurse.
And no one ever asked her anything about why or what was, if anything was going on.
Anything about her sexual history, nothing. And she says that was the one red flag that people could have gotten an idea that I was being trafficked. Because she was being trafficked from home by a parent. And her safe place was school. But the nurse never asked.
Yeah. So let's see, what other questions did we have? Any other signs? Oh, what questions would you ask her as medical professionals? What would be something you would want to ask Sam to try to get some more information that you could potentially report?
So how did she get a tattoo at the age of 12?
Good. Yeah. How? Who took you? Did your grandmother sign that? Yeah. Exactly. Anyone else? What's that? How do you feel about the pregnancy? Right. That's a very good question. So the story that this is loosely based on is a kiddo, and she ended up having multiple abortions before the age of 14 and had no feeling about it. None. That would probably be a pretty good indicator. Some trauma. Some other things that are, I think, notable is the dark circles under her eyes. She's exhausted. She has an iPhone XS Max. Those are like $1,000. Let's see. She's very hypervigilant. She hears the noise in the hallway and startles. She's always looking to see if somebody's coming. She does not want to put her phone down. That's kind of typical of teenagers.
Yeah, so what's different about that? What do you think? Because teenagers and some adults cannot take their eyes off of the phone. So what might be different about a kid who's being sex trafficked versus a kid who's just wants to be on their phone looking at their Facebook feed or whatever, Instagram or whatever? It has to be available all the time. It has to be charged all the time. And they're checking in with somebody all the time, answering text or communications in some way. You know, if I don't answer this text in the next 2 minutes, something bad is going to happen.
So fear, probably.
Lots of fear.
One of my kiddos who was sex trafficked would come into my room for therapy and immediately plug her phone in, even though it was mostly charged, because she is terrified of letting that thing die. And she was constantly checking in on her phone the whole time. So, some signs to look for. Like we said, exhaustion, the dark circles under her eyes.
So we're not just talking about, I'm tired because I stayed up too late last night. We're talking about chronic exhaustion, you know, where you look half dead. You're so tired. Okay.
And there may be other medical things that you guys could identify that we have no idea about that would maybe, yes?
The runny nose, the red nose, as well as constipation.
Yes.
Opioid abuse or some sort of drug use.
Yes. Yes, absolutely. Very good. Constipation, and I'll get to this a little later, but the constipation is something that we see with kiddos who are extremely dissociative. So dissociation is a trauma response when you separate from your body psychologically, and you imagine sleeping with people or being made to sleep with people 20 times a night. You're not going to want to be in your body for that experience. And so this child that particular sentence was about would not know when she needed to go to the bathroom. She didn't know when she was hungry, thirsty, anything. And so she was severely constipated most of the time. Poor hygiene. You know, they may not have access to showers where they're living. A scripted or canned story. Kind of the vague story about how she got pregnant or who the father was. That's something you might want to look out for. Not knowing what city they're in. Big sign right there. Story often doesn't make sense, or it just sounds like it's something they say a lot. Just a really short sentence about, oh yeah, I live with my uncle down the street in the city. Highly sexualized behavior or dress. This can be, I think it can be both. I've seen this with multiple kiddos, but I've also seen the opposite, where they wear very baggy clothes, completely covering their body, huge jackets in the summertime, just not wanting anybody to see their body. So these are some physical symptoms you could look for. Trauma to the vagina or the rectum. You know, a lot of our SANE nurses always tell us, Megan, there's not going to be a lot of physical symptoms when it comes to rape or sexual assault of a child. If it's one time, it heals very quickly. There's just not a lot of physical evidence that we can get from SANE exams sometimes. But if a kiddo is being trafficked, they're likely to have trauma.
And they will have some medical treatment, right? Almost never preventative care. That they will be taken to the hospital or urgent care because they're an object. They make money for them. They have to keep them up and running, right? But they're not going to get them preventative care.
Yeah. They're an asset. They don't want to lose that. Yeah. Also, just as an aside, I think the average age or the average length of the life expectancy for a kiddo who goes into sex trafficking is about 7 years, something like that, 5 to 7 years. So it's extremely lethal. And the average age of entry is 12. So pregnancy at a young age, please pay attention to those. Evidence of abortions at a young age. Lots of UTIs or STIs.
Yeah. You know, not wanting to go to school because they work all night. They're tired. Now, some of these kids, school is the one place they feel safe, like the kid I told you about before. So she would work all night and go to school, but then she would fall asleep in class. Her grades suffered, but she was still passing, amazingly so, passing, and able to graduate from high school, all while being trafficked.
History of running away from home or foster care placements. Several of my kiddos who've been trafficked have been foster kids. I think they don't really feel like a lot of people are looking out for them or care about them much. So they decide being on their own is better and they run away. And it kind of makes sense, you know, if you think about they need to have shelter, they need to have food, they need to have clothes. They're going to find a way to do that. and they don't have a lot of skills to go on because they're 12. And so a lot of times this is the way that they're surviving, is through sex trafficking.
And the other thing is that these pimps know exactly where the emotional wounds are. I mean, I don't know how they are so good at it, right? But they can pick up that this kid over here feels like they're worthless. And so they're going to pay attention to that kid. They're going to make that kid feel very special, that they're the only one who understands them, that they're wonderful, right? And bring them into the life that way. Another kid is going to be through drugs, right? Another kid is going to be through, I want certain things. I want to have the latest iPhone. And so that the promise of giving them things, and so that the promise to earn their way. Right. Is the way they bring them up. But they'll find it, and they find it very, very quickly.
Yeah.
Yeah.
And the case study, the young lady that one of the piece of the story was based on, she did want to have a lot of things her grandma couldn't give her, and so she found her way into life through online things, pictures, in order to get certain money sent to her, and it just escalated from there. Constantly checking in, we kind of went over that earlier. Substance abuse issues.
This is also the way that they can control them, right? They can keep them under their control by feeding them drugs, you know, whichever those are. Usually it's the cheapest and the ones that produce the most high and the most addiction.
Hypervigilance. Hypervigilance is just, scanning your environment for anything that's dangerous. A lot of my kiddos, they startle easily. They jump very out of their seats when they hear a noise. They don't trust anyone. Fearful, anxious, depressed, submissive, tense. I mean, I've seen it this way. I've seen it present this way, and then I've seen it present very angrily, very defensive. You don't know me. You don't know my life. How could you understand anything? Just very angry. Frequent physical complaints, like we talked about, constipation, stomach issues.
And just remember that this is the way that stress is shown in our bodies, right? Because even, those of us who are under high stress, we have headaches, we have stomach aches, right? We have difficulty eating, and all of that stuff is stress, right? And these kids are under a tremendous amount of stress, so you see lots and lots of physical complaints from them, and usually that is the way that they come in for treatment, is just because they have migraines or they have severe stomach pain. Yeah.
And they do always get treatment, and so you guys have an amazing opportunity to get these kids to safety. Show signs of physical abuse, sexual abuse, restraint, confinement, or torture. Again, like we said, this isn't always what we see, but this does happen.
Yeah. So just like the little kid we talked about before who was pregnant, they have a lot of sexual partners. Treated a young person that came into treatment at age 14. When a sexual history was taken, they did not know how many partners they had. And I said, so are we looking at like 5 or more? More than 10? Yes. More than 15? Yes. More than 20? Yes. More than I can count. That's what I ended up having to write down. More than I could count.
Yeah. And this is something that I don't, and maybe you all do this, and that's fantastic, but I know a lot of medical providers do not ask anybody who's a young kiddo coming into your office how many sexual partners they've had. It just doesn't feel like a natural thing. And maybe you guys have rules and regulations or procedures on if they're 13 and older, we ask this, but it is important to ask anybody who you think might be a
this
victim.
And about substances, because the average age of use of substances is 8.
8 to 10 is the first time they're starting to use. Poor concentration in school, and this is also could be poor concentration in your room or wherever you're meeting this child. They may ask you to repeat your question like 3 times, and you think and they may say, I don't know, and you might have to ask again and again, because when you are severely traumatized, your whole brain, your brainstem, everything is working to keep you alive, to keep survival, and it's not really allowing a lot for anything else, any other processes to happen.
So being closely monitored. So this we cannot stress enough. So these kids will present usually with an adult, and we will get to this, do not assume that they are their parents, because they aren't often their parents. And they are there to monitor them. They're there to make sure that you don't know anything about their life. And they can be monitored by an adult or another peer. And so, you know, being able to talk to them by themselves is going to be super important.
Very important.
We can't stress this one enough.
Mm-hmm. Like we talked about earlier, branding tattoos or burns. So how do you help? These are some suggestions we have, and hopefully these are things you guys can incorporate into your practice. I know that, again, you guys have a lot of rules like we do, so maybe just think of some creative ways to do these things. Be careful with your language. So I had a session yesterday with a kiddo who is sex trafficked, and she had no idea what the word sex trafficked meant. No idea. And so when you wouldn't want to ask, have you been sex trafficked? They probably have no clue what that means. So you're going to want to say things like, has anybody ever paid you money or given you things to have sex with them or do anything with your body? Be very specific. You don't want to use jargony kind of medical terms. Just be very basic, because again, trauma really takes most of your brain's power away from you, and they might not understand a lot of the words, and they're just going to tune out.
And be aware of the power dynamics. So one of the things that you want to do is, if you're talking to somebody, you want to be lower than them. You know, so if they're standing, I sit. If they're sitting, I try to be a little lower. I want to be very positive about where is my body. If my core is right here and it has a lot of energy in it, and if I am talking to you and you are a possible victim, then I don't want to stand like this facing you, because this is a confrontation. Whether we understand that or not, our bodies start reacting. Our hearts start beating faster. We get tenser, right? That's a really bad way to do it. So I'm going to turn my core away, and I'm going to talk this way. I'm going to have a lot more distance between them, right? I just saw a little kid, 2 years old, for the first time, and he came in with his mom, and we were this as far apart as my office is. That's how far apart I had to be from him, for him to be able to take a breath. Otherwise, he was holding his breath, and he was like this. So I just kept moving backwards and backwards until my back was up against the wall. And I had my body faced away from him. And when I was all the way as far as I could get, he looked at me a little bit and he grinned. And I knew, okay, so that's how far I have to be every time I see him until he invites me closer, right? And it's going to be the same with them, as much distance as you can give.
Yeah. They're not going to give you a lot of information with their words. It's going to be nonverbal.
No, a lot of with their body. And, you know, when you talk to them and you ask a question and you don't get a verbal answer, but you get this, a slight lean back, that's a positive. That's a yes.
Yeah.
Yep.
Rebecca and I, in our counseling rooms, have our chair. Well, we sit in a chair and our clients sit side by side. I know in a lot of movies you see people
like this,
right in front of their therapist. That very rarely happens. It's a very confrontational thing in the animal kingdom. Rebecca always says that's confrontation. You never do that. You want to sit side by side. And there are some kids that are so reactive that we never make eye contact with them throughout the session. All of it's peripheral, you know, and they are able to open up that way. So whatever works with your kiddos. Do not assume the adult accompanying the youth is their parent. They will say they are. This is really tricky because they're minors, and you have to get consent from parents, and you have to do all sorts of things by the book, because you can't ask kids certain questions without their parents, all of that. I don't know exactly how you all are able to do your jobs, but if you can find a way to meet alone with the kiddo, even for 5 minutes, that is, it's crucial. It's huge. You might be the only person in months who has had the opportunity to sit with this kid alone for 5 minutes.
So if the kid doesn't speak English, do not get someone in the vicinity to interpret for you. Get an outside interpreter, because they always have people available to be on hand to assist you. And they're going to tell you what they want you to know, not what the kid is actually saying.
Even if you have to call the language line.
Yeah.
I don't know if y'all have that. That's better than getting the parent or someone to translate for you. Speaking privately, we talked about that. Identifying a safety word. right away, if you do get them alone, you might want to say, hey, if you want to stop discussing this, if something happens and what we're talking about needs to end, say this word. And it's going to be something that's not normally used in everyday language, so that they know that the conversation will stop if they want it to.
Mm-hmm. So allow them as much control as possible. And so you're going to have to do your job. And so if you have to do an examination, maybe you say, would you like for me to look in your eyes first, or would you like for me to look in your ears first? Would you like for me to listen to your heart first, or would you like for me to palpate your belly? Whatever it is that you have to do, and it's not, of course, life-threatening. You give them as much choice as possible. Those are what we call forced choices. That's the way you do them. You don't say, hey, look, I'm going to do it anyway, right? But you just know that I'm going to do this first or this first. Both of them are going to happen. You know that. Okay?
Yeah. And their choices have been completely taken away from them in all aspects of their life. So giving them that control can make them feel a little bit more powerful and maybe a little bit more brave to be able to ask for help.
Mm-hmm. So I don't know if you guys saw the article that came out this week about kids who have been sexually abused. They are much higher risk for suicide, completion, and attempts. And unfortunately, what happens, instead of it getting less, but as they get older, it gets worse. Okay? And so these kids are sexual abuse on steroids, so a lot of risk. So assess risk of harm. Okay?
Don't ask for unnecessary information as much as possible. I know we all work in careers where we have to ask questions constantly, but try to pick and choose those questions very carefully, because overloading the kiddo with questions is going to make them clam up, and so you're going to want to ask safety questions first and things like that before any unnecessary things. Listen to them about their safety.
Yeah. If they say I have to answer this text in the next 2 minutes, let them do it.
Mm-hmm. Or I'm scared to go home.
Yes.
Call the police and report.
So everybody's a mandated reporter. Everybody in this room, everybody in the state of Texas is a mandated reporter. That means you have to report it to the abuse hotline, to the police.
Child Protective Services.
Child Protective Services, right.
Or the police.
Yeah.
Somebody. There is the National Human Trafficking Hotline, like we talked about earlier. You all are medical professionals, so you have to follow HIPAA guidelines. We had another kind of sex trafficking conference recently, and it was brought up, how do I report this if I don't have a release? You can't, so you call CPS and law enforcement who can. And once they're able to intervene, they can call the trafficking hotline, or you can tell them to call the trafficking hotline, because they do help. They do amazing things that we can't do, and that CPS and law enforcement can't do.
Give this number. If that kid doesn't give you any information, but you think they're trafficked, you give them that text number, and they say, if you text here, they will help you. That's all you need to tell them.